Well, good evening, everyone. Today is April 1st, 2025, and this is Tustin Longevity Center's weekly YouTube Ask the Doctor Anything, and I'm Dr. Ellithorpe. I am a functional integrative practitioner here in Southern California. I've been practicing integrative functional medicine for, 44 years at least, but I've been aware of the whole nutraceutical move since my father was in food research, even when I was a 4-year-old. So maybe it's more like 68 years I've been involved in functional, integrative, complementary, alternative medicine. So here, what we do is we do these email questions that you can type into me. I get them at the end of work. I'm always in my workout clothes because I usually work out right after this with my husband doing our weightlifting at the gym across the way here. So I get the emails without much time at all to pre-screen them or anything. And if you're interested, if you go to tlcdoctors.com, that's our website, TLC Doctors, plural, doctors, plural, tlcdoctorsplural.com. You can sign up for our newsletter, and then we'll notify you of each of these coming up. And then you can get a link on the notification. If you have a question, you can type in your question. And then we will take up all the questions, usually by about late afternoon on Tuesday, 4:45, 5 o'clock, because they try and bring them over to me by about then. And then I'll try and answer as many as I can. We also have the YouTube. So if you're on YouTube and you're in the chat and you can get onto it, you can type in a live question. And I tend to go to the live questions first. So let's start today by saying welcome. And if this is a benefit to you, then we would encourage you to please like and please subscribe, share this with your friends and family. It's not meant to be personal medical advice at all. It's just given a symptom complex or a problem, you're just trying to get a feedback on what I'm thinking, what we do here. The healthcare providers, there's 4 of us here right now. And what a integrative functional doctor begins to think as we start seeing, a problem, a question with symptom complex. But again, this is for educational advice, is not meant to treat anyone in particular. So we're starting to get some questions in live. Tiziana, hi Tiziana. It says here, hi Dr. Rita, how many hours should we do a water fast for gut health? Resetting the gut. Thank you. I think the upper limits on that, Tiziana, after a decade or two of aggressive studying of water fasts on top of intermittent fasting. But the data is much more than I had 30, 40 years ago. And the answer is a 3-day fast seems to give you the peak volume of reparative value. Much beyond 72 hours, there seems to me a greater potential for muscle wasting, eating up valuable tissues. So all of the breakdown products of marginal cells, cells that are injured, cells that are not functioning optimally, that can be identified during a fast and cleaned out autophagy, are going to occur starting probably towards the 24th hour. And then between 24 and 48, your autophagy, your cleaning time, appears on most studies to be the maximum time. And then there is yet still benefit into the 3rd day, but there's clearly more potential harm beyond 72 hours. So that's what my suggestion to you would be, is the maximum hours would be 72. I used to do a 5-day fast. I am now cutting it back to 3-day fasts. Now you can do them more often. I used to do a 5-day fast twice a year. And now instead I do a 3-day fast twice a year for sure. And maybe I'll do it a 3rd time as well. So there you go. Carolyn, a live question pops up. Thoughts on methylene blue for fatigue and rheumatoid arthritis? Methylene blue is an antioxidant. It's been around forever. So I've known about methylene blue for my entire practicing life. I have never seen it used in a sense where it made the average difference in long term outcomes. So I've been practicing medicine so long now, in my 44th year of practice. I'm glad to be invited now to my patients who are hitting their 100th birthday, their 90th birthday, really making it to the riper, older double digit and now triple digit age, and yet be happy and functional. And very often, I went to a 90-year-old's invitation and he's still playing pickleball. So these antioxidants that have brought us through to these patient outcomes, I would say, I am going to name them by name. It's Juice Plus is probably the number one with the greatest amount of research that I can see consistently in these patients that have provided a vast, multi innumerable polyphenolic antioxidant uh, you know, feast, you might say, to your body as to what you need, because they are the 30 fruits, vegetables, and berries dehydrated in an oxygen free, dark environment, which is very critical to know that you're dealing with a reputable producer. Plus, I've been to their plant, and plus, I've used it myself for now about close to 30 years. And I've just got to say, that's the antioxidant I'm going to go with. I'm not going to pick out one when an apple alone has maybe 10,000 phytonutrients or more. We don't know everything. I do like methylene blue because it is an antioxidant that has two valences, meaning it's able to donate and receive two electrons. So it has this kind of duplicity in its methodology. But it is more to me like marketing. I just think this is a lot of marketing that's going on at this time. I'll tell you, back in the 1990s, the absolute rave was to give ubiquinone, which is coenzyme Q10. In the 1980s and 70s, it was tocopherol and tocotrienols. You use a fancy name. That's basically vitamin E. And then in the late 90s, early 2000, the rave was resveratrol. And then it started to expand. So us old doctors who have been doing decades and decades worth of this over 40 years, and me in excess of that, I've practiced and been involved in food research way over 44 years. I have actually seen it work in patients, and looking for a single nutrient is not the direction you go. I'm not against methylene blue. I wish we had some of the money and the income that is available to do good, healthy, blinded, controlled research on these things. But of course, until we clear up this corruption in pharmaceutical influence research, we're never going to get the money we need to really clarify so I can give you an accurate answer. So all you're left with is the antioxidant studies I've published, my own little self, and nobody in general medicine doing our own publications. Yeah, because I care. And so until that happens, we're not going to get answers. But I'm not against methylene blue. It is a powerful antioxidant. It does have a unique aspect to it, that it has maybe 2 times the ability to donate electrons due to its biochemical structure. Let's see. And then of course, Caroline, for fatigue and rheumatoid arthritis, you want anything that can donate electrons and help transport electrons along. The methylene blue is towards the end of the Krebs cycle complex, which is very much helpful in facilitating this electron donation and can amplify ATP, or at least support the production of it. And anything that does that helps to reduce inflammation, and that would be the rheumatoid arthritis. Jackie says, "Hi, Dr. E. Is there a place to direct people to see the data on the COVID shot and how they are not safe?" I would go to Children's Health Defense. Children's Health Defense. I have this on all my lists of handy dandy duties. Handy dandy duty information. Where is it here? Children's Health Defense. Well, it's not jumping out right in front of my eyeballs. I haven't used it in a while. Oh, here it is. childrenshealthdefense.org. Children's, plural, childrenshealthdefense.org. And then, of course, you can get the nice delivery of the information on it from Del Bigtree's The High Wire, and that's called thehighwire.com. And so that's where I would go for that. I am hearing more is coming out, but I don't know where to find it or to show people who still need it. Yeah, so send them to thehighwire.com, thehighwire.com, and then send them to childrenshealthdefense.org. When you go on to thehighwire.com or the Children's Health Defense, that's where the lawyer Siri, SIRI, and he has multiple legal cases that he has won against the CDC and the HHS over the past 15 years. Remember when Fauci was saying we have studies that are double-blind controlled studies on vaccines, and Mr. Siri, the lawyer for the Children's Health Defense, said, please send it to us. Then they did a FOIA demanding it a legal action. And then more than a year later, Dr. Fauci never gave any reference to any double-blind controlled study on children's vaccines. And then eventually the court case was one where it's established that there are none that prove the safety of children's vaccines in a double controlled blinded scenario. All right, what's the next question? My daughter is 8, this is from Gwen, and is having pain in both thighs. We think it's growing pains. Are growing pains a thing, or are they a sign of some deficiency? Thank you. All right, praise the Lord. So what we want to say is, how long? This should not be a continuing, growing, persistent pain. They should be coming and going. You should have a pediatrician, a local doctor. So when I see anyone with growing pains in children, yes, indeed, it can be just the higher metabolism, and the femur is growing and the demands on the body. So it's very important to have very good nutrition. That would be a good case for something like Juice Plus. If you used it, Gwen, then you could give it free to your child, I believe, in Juice Plus for 4 years, and they would get that wonderful nutritive value. Plus, if they ate enough healthy proteins with fats, they're going to get the minerals in those proteins and fat. Meat would be a high value one. Liver, chicken, pork, fish, all would provide tremendous bioavailable minerals to the child, and that would help stop the pain immediately. But if it doesn't, then I would certainly recommend you see the pediatrician. Make sure there isn't a trauma that has been missed or associated with the onset of the pain. But I don't recommend getting x-rays unless the doctor there feels that the pain is lasting longer or crescendoing, getting greater than would be expected for what we call minor leg pains with age, growing legs. And this usually is at nighttime when the child is trying to go to sleep. They complain that their thighs, the tops of their thighs ache. And that's the typical classical time they'll complain about it. Children with more serious leg pain will be complaining or start limiting themselves from play or activities due to the pain. And that's when you should not wait and have that evaluated. Um, and then water. Yes, the uh, uh, next question, Beth asks, I have an analemma wand to structure my water, but I also see that you have a vase that swirls your water. Can you explain this? Do I need more than just the wand? No, you don't. The wand is sufficient, but I like this. Now, again, I'm going to try and lift this up as fast as I can so you can see the swirl. See the swirl in there? But it's, within 2 seconds it ends. And all that's doing is in a vase, a vase like that, it is swirling it and organizing it. And this has long been understood as vortex or swirl of the water, which structures it, which amplifies its ability to be absorbed. And in studies of physics and flow of fluids in physics, this is a better way to deliver water to any system. Now, with it being more structured just by the mere fact that it's in a swirl and it gets organized, then what I do is when I'm drinking my glass of water here with my wand in it, you can see my wand right there. As I drink the water down, well, I've got a lot of water in here. I'm not going to take the time. I just pour right out of my vase and I pour it right into my glass because sometimes I'm so busy, I don't have a lot of time to do the swirling. And if I'm pouring in already structured vortice swirling water into my glass with a wand, it more spontaneously will structure without my having to take a half a minute to stir it. So that's why I do it. Besides, when my grandchildren come in, they see grandma's desk here with her swirling water, and it makes them want to drink grandma's water. So that's another reason why I have my water both at home and here. And the next question is, Gwen says, one more from me. I'm having knuckle inflammation just on my wedding ring finger. Could it be scar tissue from removing my ring every night or possibly arthritis? When I would have to see your finger, I don't think, when all of us, when we take our rings on and off our wedding rings, I don't think that is traumatic enough to generate scarring at all. And you might have some sensitivity to the metals that it's made from. You could be developing some metal allergy. It could also be something recently got stuck under or in your ring there when you were cleaning or doing something, and the material that got stuck between the skin and the ring created an irritation. If this is persistent and progressive, you should have that looked at. You can always get your SED rate, your HSCRP. These are inflammation blood tests. There are other special autoantibody screen panels that your doctor can order for you. If necessary, they could do an x-ray on that. They could look for your uric acid. But if we eat a low-carb diet, fruit sugar, fructose, remember half of granular sugar is fructose. So it's one glucose and one fructose molecule equals a dimer called sucrose, which is your table sugar. 50% of that sugar then that you're putting in anything, any teaspoon you take of it, 50% of that is fructose, and fructose promotes gout. And gout is really a metabolic disruptor. Fructose is a liver toxin. There's really essentially no need for fructose in your diet or sugars at all. So think about those things. And Constance says here in the live chat, I know not to eat bread, but is sourdough better than a multigrain seeded? I think you're pushing the limits there. I know there are podcasts, and thank God for all these people starting to get on board, make money on YouTube's, sell things, get notoriety, get whatever how you make money on YouTube. I'm glad that it's happening for them, because this kind of information is forwarding the whole motion of wellness awareness. And sourdough bread has, through fermentation, some of this material that helps chew up the sugars that are in the bread, then you can make an argument that there's some benefit to it. I'm going to say that's such a small point that it's basically useless. I just don't see that bread is really of much value. And then we always take it to the limit. It reminds me when resveratrol was used to popularize drinking wine. And the highest, I think, wine containing resveratrol is Pinot Noir. And that wine has more resveratrol per milliliter. But I think a whole, I'm not sure if I'm remembering this correctly, but I think the highest concentration of resveratrol was something like 1.1 milligrams per deciliter of fluid, which means if you need 1,300 milligrams to be effectual in having a powerful antioxidant effect on your human body, 1,300 milligrams, that means you're going to have to probably drink, 8 bottles of wine, and you'll be drunk, and all the toxins from the alcohol content will harm you. So you see the ridiculousness of talking about one potential little molecule of value when the basis of that wine is really destructive. So the same thing goes for sourdough bread, in my opinion. Sorry to be so negative on that. I am watching these YouTubes as I'm studying things. Something will pop up and it'll say, "Did you know that diabetes is cured by doing this 7-second routine every morning?" Or, "Did you know that your tinnitus will go away with this?" Or that your old, broken off, rotten tooth will grow back, if you take this or that. I have to watch these things because sure as anything else, they're going to come to me as a patient one of these days and ask me, "Did you know that this or that helps grow teeth or enamel?" And what they'll do is they'll take some small biochemical nutraceutical redeeming value of a mineral or a herb plant or some kind of um, food item, and they'll massage that into a product and put a whole story around it so that at the very end you're going to think the people already. Your trust is going to go into them. You'll identify and say, I suffer those things, and then you'll say, well, I'll give it a try. And they're betting on, if they can get 2 million people to say, I'll give it a try, that's going to be worth their investment money, and they'll make maybe something like a few million each on benefit. Or I don't know exactly how the money flows, but most of this is just foolishness. So all that said, I'm not impressed with sour bread products at all, but I am going to try this. The last one I watched was where you take yogurt and then you mix it with something like almond flour and you bake it, and you can make, if you put an egg in it, it'll fluff up and make a type of modest bread. So you're going to get in that a good deal of protein, so it'll be a very dense, protein rich piece of bread per slice that you make in a small loaf pan. It will have quite a few carbs still, but if you're going to do something, I'd rather see you make it like that rather than a piece of sourdough bread with such a low protein content. All right, next one is Carolyn says, are the cow dung or buner or antibiotic effective products for someone that tested positive for Lyme's disease? I'm not familiar with these product lines that you're referring to, Carolyn. Cowden, Cowden, or Buhner, Buhner. Are these antibiotics effective protocols for someone tested positive for Lyme disease? Lyme disease, I mean, putting on your tinfoil hat, there are some people who say Lyme disease is a bioengineered product from the uh, bio warfare labs that was leaked out, got into the environment, and uh, because remember, it's better to disable a soldier than it is to kill him, because a disabled old soldier requires so much more money, time, and dollars to get him off the field of fighting. Two men are needed. The transportation cost to bring him back, the bed in the hospital, and the care and the nursing and the doctors and the x-rays and all these kind of things that go into caring for an injured soldier is far, far more profitable to destroy a nation than a dead soldier from an immediate bomb and be killed immediately. So uh, if you're wearing your tinfoil hat and you're of that ilk that believes that this is possible, and I'm certainly not going to say it's not possible, that the Lyme's disease may have come from research and gotten into the environment in the Northeast and the ticks and so forth. And now we have this smoldering, difficult series of infectious parasites. Now, which product kills it? And do you get long-lasting symptoms? The answer is yes. And it takes a whole venue of work to find out how long have you had the symptoms, how long has it had a chance to potentially spread in the body, what other comorbidities do you have that make your immune more susceptible to succumbing to its inflammatory breakdown products in your body. So there are so many things that goes into it. And I find it very encouraging that the whole environment with these YouTubes are awakening everyone's awareness to the lifestyle. We have to take personal responsibility for our health, drink our water, get a good night's sleep, exercise, do weight lifts, take certain nutraceuticals, because yes, indeed, the industrial system has really ruined the growing fields, and the nutritive value of our products are maybe less than 50% of what they were in the 1950s. And then they harm our livestock with using grains and seeds that they never would have normally eaten. And they would have used grass and grass alone. So we have a messed up healthcare system, a messed up financed, bought off, bribed out scenario that corrupts our food, agricultural scenarios. We have to get this cleaned up. Maybe JFK can do such a thing, but we have to stay informed and just find a good functional doctor that's got an open mind, and it'll work step by step. Don't think you're going to come to your doctor and in a 1 hour 30-minute visit you're going to get everything answered. You're going to start building a relationship and building care and lifestyle changes with your doctor as they walk you through it. Part 2, Jenna says, what can I take as a natural solution? I don't have any ivermectin right now, or I would take that. Thanks. Well, why don't you call a pharmacy in Arkansas? And now that ivermectin is over the counter in Arkansas, you can call any pharmacy in Arkansas and have them mail you some ivermectin. Now, is that the treatment for it? You would have to see your local doctor, your functional doctor, do some testing, and then have them manage it. I have seen no published literature that identifies ivermectin as any kind of a cure for treatment for Lyme's disease. Typically, they're with things like doxycycline, tetracycline, and long-term cycles of other antibiotics. And we're talking maybe 6 months worth of antibiotics. So you have to work with a functional doctor who's going to do a stool study and look at the inflammation of your bowel, maybe a complete digestive stool analysis, probiotics, look at your vitamin D level, maybe even some high-dose vitamin C. Some very advanced functional doctors can provide oxygen therapies, hyperbaric oxygen is another modality. There would be those who would argue that methylene blue would be something sought after for these chronic infectious treatment disorders. So find an experienced functional doctor, and usually you can start looking at the advertisements. Now we're seeing more and more doctors put out a statement like, I went to the American College for the Advancement of Medicine, or I went to A4M, which is another functional medicine training. There are many out there now. I'm certainly part of some of the lecture circuit and teaching back in the 1970s when they were very, very new. But a chelation doctor, acam.org, acam.org, is usually a doctor who's informed about high dose vitamin C, chelation, and other immune antioxidant therapies, ozone therapies, ultraviolet light irradiation with ozone therapies. These kind of things would be something you want to look into. So call the office on that. Jenna says, I had some blood work and a urine test last week, and the results said I had bacteria in my urine. I do not have a UTI, urinary tract infection. I would know. So you're having some bacteria in your urine without symptoms. I want to avoid antibiotics. I have felt tired this past week. What can I take as a natural solution? Well, again, we don't practice medicine over the internet. It's not unusual to see some bacteria. There's a range limit, usually, from 0 to 10 white blood cells are allowed. And, there is often some indication that there might be a bacteria. It should be cultured. That's what that urine should have, as a culture, and see if it grows any predominant organism. Whoever did the urine test, call that office and find out if a culture was done and if it grew any one particular line. In the meantime, drink plenty of water. You could take cranberry extract over the counter. There's many products that have cranberry extract in them. There's also D-mannose in products that can be taken that helps to prevent bacteria from adhering to the bladder lining. So lots of water, cranberry, D-mannose. These are things that are very often valuable for it. But don't assume you don't have an infection just because you don't feel it. Please, whoever ordered your urine and told you there was some bacteria or white blood cells in it, please ask them what the culture said. All right. And Christina says, hi, Dr. Rita. My joints and muscles have been sore. I have been gardening more, but I'm not sure if it is vitamin deficiency. My knee started popping when I walk upstairs. Thoughts and thank you. Well, Christina, how old are you? How much water do you drink every day? What is your blood sugar, insulin, triglyceride level, and hemoglobin A1C? What is your liver panel like? Do you have a uric acid for gout tested? Is there any prior injury there? What is your blood type? Certain blood types tend to have more arthritis than others. O's as a class tend to have more arthritis and get sensitive to grain and dairy adulterations through genetic modification and pasteurization and homogenization. So all these things go into a statement. What I would do is I would make sure I'm drinking half my weight in water as ounces every day. So if you're a 150-pound woman, then 75 ounces of water a day. I would consider taking systemic enzymes on an empty stomach twice a day, 4 or 5 of them on an empty stomach. And then you should see improvement within a day or two. See your doctor, follow up with a functional doctor, and start addressing these things. And then, of course, build up the muscles around your knee with strength training, stretching, and things like that. So let's go to some of these questions here I have on the email. Susie said, I had seizure disorder since childhood. What are your thoughts on carnivore diet and seizure control? And also, can I stay carnivore for the rest of my life? Yes, the answer is yes. There, I think in the 1940s, some of the very first ketogenic suppressive for uh, irretractable seizure disorder in children were developed. So the ketogenic and carnivore diets will be, in general, very safe. Find out your blood type, get a good doctor, a functional doctor who's familiar with managing patients with um, seizures and the knowledge on a ketogenic diet or a carnivore diet, and have them follow you. But I see no reason why you can't. And then Brian says, Dr. E, thank you for all you do. Well, praise the Lord. Two questions, if I may. Is the white residue that covers your tongue beneficial? Do you recommend using a scraper to remove or reduce the residue? Thank you for your time and enjoy your workout. Yes. In general, I would say most people have a slight white coating to their tongue. People who have a dramatic plaque, it looks like an evidentiary white tongue. These are likely other conditions, most likely of which is candida from too many carbs in the diet. Is such a common challenge to the American diet. And then the yeast overgrowth is there. But I have seen people argue from the left to the right on integrative and functional conferences that I have attended, because when I first started doing these conferences on integrative, and I got my doctorate in integrative medicine in 1999, I started that. Uh, we They would argue the benefit of scraping your tongue for harm versus value. And I think the answer is they don't have an answer. Um, if you have an unusual tongue appearance, you should discuss it with your doctor, get a blood sugar, get your fasting insulin, get your triglyceride level, get your hemoglobin A1C, get your fructosamine. Fructosamine, that's a fruit sugar level also. Then go from there and make a personal assessment, always knowing that the ranges for the population averages are way too high. My limit for fructosamine, I want every one of my patients under 170. I want everyone for a glucose to be 85 or less. I want everyone with triglycerides to be somewhere in the 50 to 75 range on triglycerides, or have it equal to your HDL cholesterol. So if your HDL is 60, then your triglycerides should be 60 also. And then your insulin, I don't want it any higher than a 4. And then your hemoglobin A1C, I would like it to be 5.2 to 5.3 at most. Those are the ranges. I think if you brush your teeth, good oral hygiene. I do a swish and swallow with my Argentine silver. I'll do a light brush maybe once a week or twice a week on my tongue with my soft brush. And then I leave it at that. There are other problems with other, like black tongue and a very, very hot red looking tongue. Uh, so there are diseases associated with it, but they're extremely uncommon, or very uncommon, at least I would say. And work with your doctor on that. Okay. Um, Now the next one is from Ronnie. Ronnie says, my 19-year-old daughter has been suffering since August. Symptoms are extreme dizziness multiple times a day, extreme heat on and off all day, eye dilation and sensitivity to light. Her sense of taste has been on and off since she had COVID in 2020. Would love any thoughts. We've been to so many different doctors and done so much blood work with no answers. Well, Ronnie, I would want to know her blood type and her blood sugar and her cortisol and her DHEA and her hormones, DHEA plus her progesterone, estradiol, and testosterone. I would want to know her inflammation status, SED rate, HSCRP. I would want to look at her mineral status with her blood type, especially if she's an A type blood. I would want to look at her ferritin for iron management and anemia rule out. I would want to um, do a complete digestive stool analysis, because so often, um, as stress, electromagnetic energy disrupts our very delicate sympathetic, parasympathetic equilibrium. So when we stand up from sitting down, normally as you get old and it's falling apart, we start getting these dizzy episodes. But even young people or people who have autonomic nervous incongruence, meaning a 19-year-old who stands up and can't stand for a long time, many minutes, and starts getting a vasodilation and faint feeling. This is totally abnormal. Your sympathetic and parasympathetic system should be able to know that you're standing. You need to be having a good blood pressure and maintain it for you. Maybe an elderly person's nervous system couldn't sustain it for such a long standing period of time. Aggravating features would be the menstrual cycle, which will enhance inflammation and dysregulation of the sympathetic autonomic nervous system in the body. There are certain viral illnesses that can aggravate and bring harm to this delicate balance between your autonomic nervous system. It's implied that COVID is one of them. So the acetylcholine, nicotinic muscarinic receptors are impacted by the ACE angioconverting enzyme receptors that are blocked by these spike proteins. I would want to know if she had been injected with the mRNA material, and so forth. So there's so many things that go on here that become an issue. She has to maybe address this. Find a good functional doctor that will help work with you and stick this out with her. Now, interesting. This very next question I have from Leah brings up something I would consider with her. What are your thoughts on using nicotine patch for chronic fatigue, most likely caused by Lyme's? Should those with atrial fib and or supraventricular tachycardia episodes be cautious using nicotine? Because nicotine helps in most situations where you have this autonomic nervous dysregulation. So you need to find a doctor that can discuss it and maybe use some low dose nicotine gum or patch and try that with your daughter with many other issues at the same time. Is she drinking enough water, getting up in the morning, grounding herself to the earth for 2-3 minutes, standing barefoot at sunrise, getting the infrared light, shutting off her lights at night, the bedroom, the phone and the screens and the blue light, and getting in bed around 9 o'clock, getting up with sunrise. There are many things that can work to help the autonomic nervous system. So my knowledge of nicotine is that there's two kind of receptors, a nicotinic and a muscarinic receptor for that's responsive to nicotine, and it's all over the body. So it's not like nicotine is a bad product. And there have been those with tachycardias that have used nicotine to modulate the racing heartbeats. Now, I'm not a cardiologist and not qualified to say that that's a treatment or one should try it. I just say that this is being looked into. And so find someone with experience that might be able to address this for the racing heartbeat, atrial fibrillation. Acetylcholine is what is trying to dock in these nicotinic receptors. And this is part of the nervous system. And so you have to eat a healthy diet, and you have to have adequate hydration, and a multiplicities of lifestyle factors have to be all spun together at the same time. I would never think that just taking nicotine as a gum or a patch is a one nutrient over the counter answer, because I've never believed one biochemical structure is the solution to anything. I believe it's always a multiplicity. So that's why you need a doctor to work with before you take any action on that. I've heard of it, Leah. I have heard that it has helped these racing heart rates, but whether or not you should try it, you need to find someone with more experience, a cardiologist. And there are more and more functional, or what we call integrative cardiologists, who are willing to, if you say, I'll take it on my own accord, but would you watch me as I do it, Dr. Smith, and then if you find a doctor like that, who's a cardiologist, that will watch you use nicotine on your own, because it's safe enough to be over the counter as gum and patches. So for heaven's sakes. And there are those who use it to help overcome attention deficit issues, hyperactivity disorders. They chew the gum during their work hours to stay focused and on the job, more attentive. So it's not something that's, in my opinion, of much concern for toxicity at the recommended doses, but I don't know if there's any recommendation for tachycardias, Leah. Then the next one, Jennifer. My husband passed, on January 4th, 2025 at 85. I think I did this one last week. I'm not sure. And you were reviewing a test that was only available until after this happened. It was for PTH, parathyroid hormone. It is 276.1 with a reference range. Yeah, it was high, of 8.7 to 77. I'm hoping you define a bit about what this means, if possible. Well, it's responsible for helping to regulate your calcium and phosphorus balance in your body, parathyroid hormone. And when we become ill, sometimes we become bedridden. We have many things that happen to us, especially if organ failure, cardiac issues happen. Tissues then begin to break down and calcium can spill out. Potassium levels, electrolyte levels change. And so your body does heroic efforts to try and put back the sodium where it should be, the potassium where it should be, the calcium where it should be, and so forth. And they might have drawn his blood at that time where he was doing a heroic reach for trying to bring control back to his calcium phosphorus balance. But a endocrinologist would be one better to address this question and bring it up with a doctor at that time who is managing him to see what that meant. There is a very rare parathyroid cancer. Does it involve high parathyroid hormone levels? It could. And so that may be something that was unknown in your husband at 85 years old. But that's the best I can give you an idea of what was going on and when it secreted a surge like that, usually in extreme situations along metabolic shutdown crises that often occur towards the end of life. But I'm sorry to hear that, Jennifer. I hope you have family and friends and people that are supportive to you at this time, even now. John says, for several years, I've attempted to elevate my extremely low level of DHEA with no success. I've used different brands, including that recommended by TLC. I've even tried a sublingual one from a compound pharmacy. I've used 50 milligrams. If I'm failing to absorb it, where is it going? Should I shoot for the moon and try 150 milligrams a pill? Well, John, if you take cholesterol, it's made from cholesterol. You could have been someone who was advised not to eat eggs and not to eat egg yolks and meat and cholesterol-rich foods. So you have a whole body deficit of cholesterol. You might be on cholesterol-lowering drugs. All these things will have a mitigating effect on hormone production and just in general cellular homeostasis or balance and your health. So you might need higher doses if you are on any of these things or have any of these problems. If your blood type is A type blood, your ability to digest your steak or your egg yolk is even a matter. You might take it in your mouth, but whether or not you chop it up and then it's absorbed is a whole nother thing. And since your DHEA is made of that, as well as many of all your hormones need cholesterol, then this might be a whole pattern. So you would have your doctor do your DHEA, do your cortisol, do your testosterone level, and look at estradiol level in you. But that's what I would think. Find a good doctor that can help look at those things for you. Find out if you're at risk for having poor cholesterol metabolism that's so necessary for these things to be of value in your body. But personally, I know of no harm to taking DHEA 100 milligrams a day or 150, but have it monitored by your functional integrative doctor or your endocrinologist. Richard says, how much exposure are we getting to bisphenol BPA? These are the products that are lining the inside of our cans. When you get a printout from the register, a receipt, they spray kind of on laser the numbers and the checkout receipt, and that's on a paper coated with BPA. So this material is associated with endocrine dysregulation, significantly so. I would just not eat canned food. I would get the green beans and cook them yourself in your own pot of water and have fresh green beans or bake them or however you bake them. So how much exposure are we getting to BPA? Well, I'm not getting much because I won't touch my receipts. And I tell every cash register, please put gloves on. Don't handle those receipts. Or I don't buy any of the plastics or the canned foods that have it in it. Or if I have something with it, it is so rare or it's from someone else so I want to go eat it. So I don't think it's that much of an issue if you're aware of it. Yeah, and I think that we should have the glass bottles for our infants again and not these plastic bottles. So, correct. He went on to say, so eating and drinking things put in cans is exposing us to BPA. True. Can we test for BPA in our systems? Yes, you can. That's on paper chromatography or spectrophoramorphic analyses. That's very, very expensive. So I hopefully that answers your question, Richard, or gives you more insight. Margaret says, what is the difference between reacted magnesium and magnesium phosphate? Reacted magnesium is having it bonded to something like an amino acid, magnesium glycinate, magnesium sulfate, magnesium citrate, magnesium malate. So these amino acids are much better absorbed through the gut, and you get a much higher and more bioavailable, bioactive form of the magnesium. Whereas magnesium, what was the other one? Phosphate, those are just two pieces of mineral. The ion absorption of magnesium phosphate is extremely low and probably pretty much valueless. Carl says, what are your thoughts on drinking raw cow and or goat milk? Do you drink it yourself? The answer is yes, from time to time. If I have milk, I buy the raw, unpasteurized, non-homogenized dairy at Sprouts. He goes on to say, where do I get it from? I go to Sprouts and I buy their organic pastures products. We had the man, in fact, he was invited by JFK Jr. So the man I had here years ago with his farm to help popularize his raw milk, I had him do some speeches here. Now he's been appointed to work with RFK Jr. on this very issue. But his farm is called Organic Pastures. It's in California here. We've been to his farm. It's lovely, very clean, beautiful, happy-looking cows, free cows. Okay, Jenna says, blessings, my 69-year-old husband, who is healthy, does not drink. He exercises, he eats well, and is on no pharma meds. Wonderful. he got back his PSA biopsy, and it's 5.3. 7 out of 12 samples came back as a group 1 Gleason 6 score. So that would sound very low risk. We are choosing surveillance and ivermectin fenbendazole daily. As long as your urologist, oncologist knows what you're doing and they can follow you, maybe you can find a good functional integrative doctor to follow along with you. Um, so you're saying any recommendations on the doses of each? I couldn't recommend it because we don't treat prostate cancer or any cancer. But the studies that I have seen, the testimonials that are coming out in the blogs, like Joe Tippins, they're basically saying fenbendazole. I've seen recommendations for 444 milligrams, 4 days on, 3 days off. The ivermectin is around 12 to 24 milligrams, 3 days on, 4 days off. I have some people using one or the other. I have some people who have chosen in my practice to be on both at the same time, and they're using them on the days off. So if they're on fenbendazole for 4, then they're off for 3. Those 3 off days, they put in the ivermectin. So there is no training. There's not enough research. Again, we need this income that has been abused and the fraud to promote all these pharmaceutical get rich quick schemes controlled with their patents for a single drug need to be stopped. And we need to get income funded for food research, nutraceutical research on things like this that the people are demanding. And so we can find safe things to advise, because I can't tell you, countless numbers of my patients are asking me this very question. So yes, I have to go to NIH, I have to go to PubMed, I have to go to the internet, I have to go to all these vlogs and blogs and read, and it leaves me very little bit of a life to live on my own. But I do this because I love God and I love serving his creation. But in no way can I say that this is standard of care or this is a recommendation from standard of care. I have to say this is still in the ether, you might say, and it's all by word of mouth now. And what we need again is valid studies. Now, I will tell you that of the countless number of patients that I've seen use this now, whether or not they had cancer or were using it for something else, I'm telling you, I've never seen harm except but in one person who took too much of one of these, I think it was fenbendazole, and he did get a anemia that he recovered from, but it did create a low red blood cell count, and he did have a transfusion. Now, he was already under care of his oncologist and getting other chemotherapies. Was it the fenbendazole that did it? Was it his other chemotherapy? I think he was on oral Orgavi or something else like that. We'll never know because it was unique. But I'm saying you cannot just recommend this willy-nilly. You have to be under the care of your oncologist who's trained to treat cancers, work with a functional doctor who is aware of all your questions and needs. And maybe your doctor, like I work with a particular oncologist very well, and we've communicated over the decades. He knows what I'm doing, and he knows how I'm trying to support the health, immune, nutritive, and detoxing ability of my patients. And I never represent that I'm treating their cancer. So find a good functional doctor, a good oncologist, and let us know how it goes for you, Jenna, and your husband. We pray the best for him, but it sounds like it's a low risk. And there is a group that will say a Gleason score under 7, watch and wait, the rate of doing nothing and observing compared to a 10-year study. There are studies that say watch and wait is beneficial for that Gleason score group. All right, Annette, is the supplement pregnenolone 25 milligrams okay to take for hormonal imbalance? Well, I don't know your case. I do think that that's a safe dose no matter what. My 37-year-old daughter has been on Zoloft 19 years now. Her symptoms have worsened, which are anxiety, sadness, weepy, excessive thoughts, and hopelessness. She's estrogen dominant, currently on Estrodim. B vitamin is seeing a functional psychiatrist, which he recommended. Um, we need our hormone estradiol. What we don't need is to have estradiol without our progesterone. So there's many layers to this, far beyond what I can address on this level. But I am for finding out what her blood type is. Uh, Most A-type blood has this kind of imbalance early in life because they don't digest well. So find out if she's a blood type A, and then talk about that with your psychiatrist. Have him give me a call here, and I'll tell them about my experience with blood type A and what we find, and the balance of progesterone and checking the cycles and the DHEA, the cortisol, the B vitamin levels, the D vitamin levels, the mineral levels. All these things matter. So I think the 25 pregnenolone is fine. All right, so we're at 7 o'clock, and I have some questions that I didn't get to yet. Well, we answered quite a few tonight. Again, if this is a help to you, please go ahead and like and subscribe, recommend to your family. We're here every Tuesday at 6 o'clock to 7 o'clock. And the rest of these questions, we have 3, 6, we have 10 questions I didn't get to. Maybe I went too long on some of them, but we'll go ahead and try and get these next week. And take care. God bless.